Good afternoon, Camden, New Jersey. As you may or may not know, the state of New Jersey is the only U.S. state without a needle exchange program. It is for this reason that I am here today. Equipping drug users with clean needles is one of the most reasonable and effective weapons against the spread of HIV, AIDS, and various forms of hepatitis. It is a formula that has proven effective in countries outside of the United States, as well as the majority of states within the U.S. According to the University of Michigan Health System, out of the roughly 300 million inhabitants in the United States, more than 1 million currently inject drugs. Scary, isn't it? This deadly addiction costs our society a whopping $50 billion a year in health care, in lost productivity, in accidents, and in crime. 1/3 of all of AIDS cases are linked to injection drug use. For women, 64% of all AIDS cases are a result of injection drug use of sex with partners who use needles. Finally, more than half of all children born with HIV got the virus through drug injection. Clearly we have a problem. But how does this happen? The answer is pretty simple. It's a basic concept of supply and demand. Drug users share needles. As desperate as they are for drugs, the demand for a needle may be just as high, and users will often stop at nothing until they get that needle. Believe it or not, though, there are not enough needles to go around. This in turn creates a big problem. Surprisingly, though, there's a bigger issue surrounding this. It is that sterile needles aren't available at their demand. Now, most U.S. states have paraphernalia laws that make it a crime to possess or distribute drug paraphernalia. 10 states even have laws that require a prescription to buy a needle and syringe. To make matters worse, pharmacies that sell over-the-counter needle and syringes are often highly skeptical and therefore unlikely to sell to drug users for obvious reasons, which further perpetuates the spread of these diseases like HIV, AIDS, and other serious forms of hepatitis. In July of 1992, the state of Connecticut did an amazing thing by passing a law permitting the purchase of up to 10 syringes without a prescription. After this new law went into effect, the sharing of needles among users decreased, and there was a notable shift from street needle syringe purchases to pharmacy purchasing. Now the tides are changing. For those who cannot or will not stop injecting these drugs, the best way to avoid spreading disease is to use a sterile needle for each injection, or at least not to share needles due to the threat of spreading this disease. In dealing with this very difficult problem, needle exchange programs have sprung up more than 185 locations throughout the United States. Not only do these programs distribute clean needles and safely dispose of used ones for drug addicts, but they often offer drug treatment referrals, HIV counseling, and even testing. A study of San Francisco Needle Exchange Program that opened in 1988 found that from 1987 to 1992, a 5-year period, frequency of injecting drugs among street recruited users declined from 1.9 to 0.7 injections per day, and the percentage of new users dropped from 3% to 1%. In New Haven, Connecticut, a study tested needle returns to the needle exchange and developed a mathematical model that estimated a possible 33% reduction in the rate of new HIV infections among needle exchange program clients. And in New York City, a large comprehensive study of needle exchange programs found that the rate of new HIV infections for participants in the exchange was 2%. Clearly, this rate is much lower than the estimated 4 to 7% HIV infection rate among users not enrolled in this exchange. A presentation at the International Conference on AIDS discovered that needle exchange programs have also achieved reduction in the rate of hepatitis B infection, which can also be spread through sharing needles. In Tacoma, Washington, clients of a needle exchange program were up to 8 times less likely to contract hepatitis B and C than non-client users. In Seattle, Washington, the needle exchange program issued 181 vouchers for drug treatment, and 78% were successfully redeemed. 58% entered methadone maintenance, and 86% of those were still in treatment 3 months after intake. On top of everything, these treatment facilities are cost-effective and within our reach. The median annual budget for running a program is $169,000, with a range of $31,000 to $393,000. This translates to 71 cents. This translates to 71 cents to $1.63 per syringe distributed. So why should we adopt this program? Because we can expect to see drug addicts getting clean and sober. We can expect to see the risk of new HIV cases dropping, and we can expect to see fewer ruined lives. If this is not a future that any community should be more than happy to implement, I don't know what is. With that in mind, what can we do to change? We need to look forward to a list of possible and feasible solutions in order to help New Jersey out. For starters, the state of New Jersey needs to repeal their prescription laws. By doing this, our state will be joining the rest of the country in order to make a big change. Second, New Jersey's paraphernalia laws should be revised so that access to needles and syringes are not restricted. Local governments and public health officials should work with community groups in New Jersey to develop successful needle exchange programs. Certain states have already approved the implementation of needle exchange programs, and with the community and greater state efforts, the development of a program here is well within reach. Needle exchange programs have become a standard of public health practice around the world. They save lives, and as mentioned earlier, they can even turn them around. It would be extremely narrow-minded and unhealthy of the state of New Jersey to continue ignoring this terrible issue by refusing to make changes as a mainstay in our country. The point is that we need to get people clean needles. We need to stop the spread of these life-threatening diseases that are destroying lives. By implementing needle exchange programs, the state of New Jersey can undoubtedly aid in keeping our state as well as our country safe. Thank you.